You're welcome to the Reproductive Health segment with Dr. Ajayi. My name is Dr. Abayomi Ajayi. And today we're continuing a discussion on male factor infertility. And to do justice to that is Dr. Gbolahan Obajimi. Dr. Obajimi is a consultant gynecologist and a fertility expert. Gbolahan, you're welcome to the program.
Thank you.
Yeah, like we said, we'll be talking about male factor infertility. And let's start with the basic thing. What is male infertility?
Yeah, male infertility, well, it in itself has to do with the man in the couple being responsible for infertility. Infertility is a two-way thing. It's the inability of a couple to achieve conception despite regular unprotected intercourse. And when that has happened and you can find the fault in the male, then you say that the male is responsible for infertility. So it is not something in isolation. There has to be a meeting. It involves a couple, a man and a woman, in which you have identified that this problem is largely a male problem.
Okay. If I heard you right, when you were defining infertility, you said for 1 year.
For 1 year, yes.
Okay. Now, do you do anything for people, before we talk about how common this problem is? Because one of the questions that we get asked is, do you do anything for people when they've not tried for 1 year?
Yeah, that's a very, very good question, because male infertility does not have any particular sign or symptom to look at. So if you have someone coming to you out of his own volition, he suspects that there is a problem, because the tests are very simple, you could just run a male fertility test and you are able to have a baseline parameter for that individual. So investigating the male can be done at any point in time, at any point in presentation. And those results, or what you find, can actually help you to make future decisions, whether you need to do something at the moment or later in the future. So you can investigate the man as soon as he presents to you, because the tests are non-invasive.
Wonderful. Yes. So anytime the man presents, it's an opportunity for you to. Wonderful. Now, you said the next question I wanted to ask you, you answered part of it, but we'll still go to it. Yeah. Are there symptoms of male infertility?
Like I said, it's largely asymptomatic. Most men don't even know whether they are fertile or infertile, and that's the truth. And how they get to know is if they've been having unprotected intercourse with a few people and they suspect that they are not having conception. They met Mrs. A, Mrs. B, and nobody's getting pregnant.
Miss
A, Miss B, rather, sorry, and no one's getting pregnant. Then that, instinct comes up, that suspicion comes up. Is there a problem with me? And this thing is often done quietly. They just want to investigate themselves quietly. However, other things may lead them to present earlier. People with problems such as erectile dysfunction. This is commonly marketed by other classes of health providers, unorthodox marketers. So erectile dysfunction is one common thing people present, but in itself may not be an actual cause of infertility, but it's a sign that something is going wrong with this individual.
So my next question will be, how do you now make a diagnosis? If you say there are no symptoms, how do you make a diagnosis of male factor infertility? Yes.
Well, WHO has standards of expectation for
WHO is World
Health Organization. Okay. There are standards and expectations that will classify a man as whether he has normal sperm or abnormal sperm. Now, what is abnormal has a wide range of variety. But I think we should go over what is normal. You expect that a man that has the sperm picture of the man should be such that he has a density or volume of the concentration of about 20 million sperm per male. He produces at least 2 males, or between 2 to 5 males as the case may be. I expect that the motile sperm, those that are moving, are at least 40 to 50%. And then those that are normal, what we call morphology, are at least 30%. Anything outside this may be abnormal, but how abnormal that is will be, it's a subject for further discussion. So there could be some mild abnormalities, moderate or severe abnormalities, as the case may be.
Yeah. Good. So what you have told us is that we need to do seminal fluid analysis. We need to analyze the sample before we can tell whether there's any abnormality.
Yes.
So because I get a lot of phone calls, I'm sure you do too.
Yes, I do.
That my sperm is watery. Is there anything, can anybody just looking at your sperm say, or there's some people say, my wife said my sperm is watery. Does it?
I think those are things people believe, and I look at them as what, like I said, unfounded and unscientific, and you cannot rely on such statements. And like we said, since male fertility tests are non-invasive, it can be done as soon as you have a contact with the individual. What I forgot to say was that there are certain precautions you want to take. You want the man to have abstained for between 2 to 5 days, so you can have a proper picture of the parameters, because you want to make sure that the debris, the dead cells are less if you wait for too long or the abstinence period is too long. But when you do it within this stipulated time, 2 to 5 days, you are likely going to get a good picture of the individual, of the man. So looking at the sperm does not give any information about the quality or the quantity.
So these people who say that I've abstained for about 2 weeks so that they think I'm thick.
Very thick.
Does that make
a bloody waste of time? But it's counterproductive. And you look at that kind of ejaculate, it's going to have a lot of pus cells and many other debris in which will alter the true picture of the sperm count. So it's, the optimal times are obtaining your semen, doing your semen analysis within 2 to 5 days of abstinence, as recommended by the World Health Organization.
One thing we hear from this test is azoospermia. Maybe we just use that to random. Okay. What is azoospermia?
Azoospermia is a medical term for lack of sperm. Lack of sperm. And what it means is that the man still produces some secretion, what we call an ejaculate, but it does not contain sperm. Ejaculate are the other fluid. Ejaculate is what comes out of the penis. It contains the fluid, seminal fluid, prostate, other fluids from other sources. But sperm cells, which will come from the storage site, is not present there. Now, there could be 2 types. There's broadly 2 types, obstructive and non-obstructive. The commonest we have in this environment is obstructive. That is the passage to which this sperm comes out is actually occluded or blocked. And common things that cause this are previous infection, gonorrhea, things that will have destroyed the pathway in which sperms will actually traverse before they get out of the penis. So that can cause it. Some people can also have medical problems. Enlarged prostate can actually block that path, and they may present with obstructive azoospermia. And some people have done surgery. Some people have had vasectomy. You have already tied off the pathway, voluntarily, and that also lead to azoospermia. In the non-obstructive, which I said is relatively uncommon, not as common as the obstructive, that is due to testicular failure. Testis has actually, or is absent.
Let me just stop you here. Well, I just ask one question, yes or no. Yeah. This azoospermia, is it treatable or not?
Yes, it's treatable.
Fantastic. Viewers, it's on this bright note we are ending this program. You can see that most things are treatable when it comes to male factor infertility. And that's why we resume next week. See you then.